As ONS continues to look ahead, its commitment to shaping the future of oncology nursing remains unwavering. ONS is proactively developing the tools, capabilities, and strategies needed to support oncology nurses in a rapidly evolving healthcare landscape. ONS will continue to set the standard, ensuring that oncology nurses are equipped with clinical expertise, collaborative skills, technology proficiency, and mentorship necessary to thrive.
You're listening to the ONS podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. The advertising messages in this episode are paid for by Natera. With over 20 years of genetic testing experience in women's health, oncology, and transplant health, Empower delivers customizable and accessible hereditary cancer testing. To learn more and get started with Empower, visit natera.com/empower.
Hello, and welcome to ONS Podcast. I'm your host, Diane Barber, a member of the ONS 50th Anniversary Committee. Similar to how cancer treatments have advanced over the past 50 years, the role of oncology nurses has also expanded beyond the bedside and chairside care to include clinical trials and research, advanced practice, nurse navigation, and involvement in the pharmaceutical industry. Because of the changing landscape in cancer care and resulting change in oncology nursing role, in 2019, members of the ONS board, along with ONS staff, met with Bridgeable, a healthcare consulting company, to discuss what cancer care may look like in 2029 so that ONS could begin to build new capabilities and tools that would meet the future needs of oncology nurses. The report identified 4 variables that will shape the oncology care landscape of the future: emerging technologies, care delivery models, care delivery teams, and electronic health record connectivity. These areas of change will require nurses to establish new competencies in order to provide quality clinical care, navigate interconnected systems, and collaborate with multiple disciplines. We will reflect on these innovative roles and their impact on patients, as well as discuss how ONS has ensured that oncology nurses are equipped with the knowledge and skills to provide the highest quality care. This episode is part of our ONS 50th Anniversary podcast series. Join us monthly throughout 2025 as we feature episodes exploring ONS's rich history and promising future. Joining us today are 4 experts who will discuss their roles in oncology nursing, how they have evolved, and share their thoughts. The role of the oncology nurse navigator has evolved dramatically since its introduction in the 1990s, initially aimed at eliminating barriers to timely cancer diagnosis and treatment, and has become the cornerstone of patient-centered cancer care across the entire cancer continuum. Danelle Johnston is the head of clinical and navigation services at Genomic Life in San Diego, California, which provides personalized cancer navigation and genomic testing to help individuals make informed decisions about their health. She currently leads the advancements of integrated clinical and navigation workflows. With over 30 years of diverse oncology experience, she is recognized for her commitment to improving cancer care navigation. She currently represents ONS on the American Cancer Society's Global Patient Navigation Alliance and the Professional Oncology Navigation Task Force, and previously served on the Biden Cancer Initiative Advisory Committee. Thanks for joining us today, Danelle. Danelle, what inspired you to pursue a role as a nurse navigator, and how has that role changed since you began?
Thank you so much for having me. I'm truly honored to celebrate 50 years of oncology nursing with you. My inspiration came when my professional and personal worlds collided. After 12 years as an oncology nurse, my father was diagnosed with pancreatic cancer. Being on the other side, navigating the emotional and logistical challenges showed me firsthand the barriers patients and families face and the importance of fierce advocacy. That experience lit a deeper passion in me. I wanted to be a steady compass for patients and guiding them through their cancer journey. And that's when I found my path in navigation. When I first started, oncology navigation was still an emerging concept. I learned about the foundational principles and about the vital work others had already done in the field. It all began in 1989 with the American Cancer Society's report to the nation, Cancer in the Poor. A year later, Dr. Harold Freeman brought the idea to life, placing patient navigators directly in the community, breaking down barriers so patients could get timely diagnosis and treatment they needed. I transitioned into the professional practice of navigation in the early 2000s. A significant turning point came in 2005 when federal funding opened the door for navigation programs to grow nationwide. What began as a pioneering idea was becoming a recognized strategy to improve cancer outcomes. Professional standards started to take shape, defining the skills and competencies navigators needed to guide patients through some of the most difficult times in their lives. Fast forward to 2017, two big movements. First, the American Cancer Society launched the National Navigation Roundtable, bringing experts together to collaborate. Second, the Biden Cancer Initiative spotlighted navigation as a key driver for better cancer care. The momentum led to the Oncology Navigation Standards of Professional Practice. In the early years, navigation programs varied widely. We had minimal technology, no standardized training, and often tracked our work on spreadsheets and narrative notes. The broader healthcare team didn't always understand navigation, so educating colleagues and defining our role was essential. Today, navigation is becoming a well-established specialty. It's recognized by the Commission on Cancer, supported by CMS reimbursement codes, and integrated across diverse care settings. It's backed by evidence, standardized training, and emerging technologies that improve both patient care and program sustainability. I'm proud to have witnessed and contributed to the incredible evolution, and I'm excited for what's next in advancing navigation to better support patients and families.
Danelle, can you share how ONS resources have guided your practice?
ONS resources have truly shaped my practice as an oncology nurse navigator. One of the most important is the Oncology Nurse Navigator Core Competencies, most recently updated in 2024. They lay out the knowledge and skills every navigator needs to succeed. Another key resource is the Oncology Nurse Navigation, delivering patient-centered care across the continuum, now in its third edition. It's a comprehensive guide covering professional practice, navigation models, program structure, and how to measure success through metrics and competency. Then there are the Oncology Navigation Standards of Professional Practice. These set the framework for defining our role, guiding our scope, shaping policy, and ensuring we deliver competent, ethical, high-quality care. Together, these resources are invaluable. They help me stay current, build core competencies, and strengthen my professional development. In my current role, I rely on these resources to maintain high program standards. They help me clearly define key components, shape job descriptions, and guide program development. They also support orientation, training, and the annual demonstration of core competencies. These resources raises the quality of care today and get ready for what's next in oncology navigation. Most importantly, these resources develop and strengthen individual competency while advancing the standards of professional practice.
Danelle, as we look ahead to the next 50 years, how do we prepare the next generation of oncology nurse navigators for roles that may include decentralized cancer care models and further integration of technologies such as AI and clinical decision support tools?
Preparing the next generation of oncology nurse navigators means equipping them for a rapidly changing landscape. We now have strong evidence showing how navigation improves treatment adherence, reduces disparities, and enhances patient outcomes. Navigation programs are becoming key components of value-based care models and quality standards. But recently, a study showed over 80% of navigators still lack adequate technology tools. To address this gap, future navigators need to be tech-savvy, not just basic computer skills, but proficient in telehealth, remote monitoring, and especially AI-driven clinical decision support systems. They'll need to understand how these tools work, how to interpret AI recommendations, and most importantly, how to integrate them thoughtfully into patient care. As cancer care moves beyond centralized hospitals, navigators must be ready to coordinate care across settings and communicate effectively through digital platforms. This calls for strong skills in remote patient support, advanced communication, and a deep commitment to equity, making sure no patient is left behind because of technology access issues. To support this, education must evolve, including training on new technologies and emphasizing continuous learning so navigators stay current with innovation and best practices. But it's important to remember why technology can enhance what we do. It will never replace the human connection. Navigators remain the vital bridge, advocating for patients and ensuring care is always patient-centered and compassionate. Ultimately, preparing future oncology nurse navigators means blending clinical expertise, technology, proficiency, and advocacy to improve outcomes and sustain high-quality, equitable cancer care well into the future.
Thanks again, Danelle, for joining us today.
Thank you.
Clinical trial nursing has undergone a remarkable transformation from a support role to a central pillar in research options. Oncology clinical trial nurses are no longer collecting only data. They're intricate members of the research team, contributing to protocol development, patient advocacy, and ethical oversight. RuthAnn Gordon is a family nurse practitioner and oncology certified nurse with nearly 30 years of experience in oncology, including over 2 decades at Memorial Sloan Kettering Cancer Center in New York City, where she serves as the director for clinical trial nurses and advanced practice providers, leading efforts to mentor and support staff in delivering exceptional clinical and research care to patients participating in trials. Thanks for joining us today, RuthAnn. RuthAnn, what inspired you to pursue a role in clinical trials, and how has that role changed since you began?
Thank you, Diane. I'm excited to be here today. What inspired me was actually a chance meeting. I started working here at Memorial in our radiology department, but I had been an oncology pediatric nurse prior to joining Memorial. I was really interested in going back into pediatrics, and there was an opportunity in clinical trials, a first-in-class kind of role in our pediatrics area for clinical trials. And I went to learn more about it and immediately fell in love with it. It gave me 2 of the things that I was really interested in. I was really interested in oncology, was really interested in pediatrics, but I was also interested in innovation. And this gave me sort of that entryway into that. It was an amazing experience to learn how we bring drugs into development, how we work with outside entities to optimize the clinical trial, to work on the logistics, to figure out how to operationalize a clinical trial. All of the aspects of it, including the patient care, was pretty exciting. I love the dynamic nature of it. Certainly, you're continuously learning. You can learn the role of the research nurse or the clinical trial nurse, but then you open up a new protocol and you're ready delving into something completely different than you've done before. And it just becomes so exciting to kind of learn that new study and figure out how it's going to impact the patient, how it's going to impact the organization. All of those things are pretty exciting. And I knew that that was going to be it for me. I have been doing this ever since. I have been lucky enough to now have a leadership role within the organization around clinical trials and really seeing its evolution.
Can you share how ONS resources have influenced your practice as a clinical trials nurse?
I think that if I talk about how the role has changed since I began, when I was first introduced to the role, there weren't published competencies in order to learn the role or any real standardization of the role. And so when you worked in clinical trials, you kind of picked up things from the providers, from the other investigators on how, you should operationalize the role. We've seen that evolve. We've seen ONS develop competencies, ONS come out with the clinical trial nursing manual, And in our organization have been able to use those tools to standardize the practice of the clinical trial nurse across our institution. So we take those competencies and they are sort of the foundation of our program. And we've been able to build our program over the last decade, mostly by the use of the tools that ONS has and the ability to share knowledge. Like not only are the nurse competencies, but I think about all of the conferences that our clinical trial nurses participate in and share knowledge with one another. And that has been a real benefit to the growth of the role, I think, is the sharing of information in those venues as well as published work.
So as we look ahead to the next 50 years, how do we prepare the next generation of oncology clinical trial nurses for roles that may include decentralized cancer care models and the further integration of technology such as AI and clinical decision support tools?
When I go back to the evolution of the role, the research nurse and the clinical trial nurse is very much engaged in the patient management aspect of a patient being on a clinical trial. So that's their symptom management, that's their patient education, all of the things that it requires in order to manage a patient clinically, but then they're heavily engaged in the protocol management, whether that is the tools for activation, whether that's the queries, auditing and monitoring, all of those aspects, all the regulatory natures of that. As we evolve with technology, those roles continue to sort of be incorporated into that. So I look at decentralized trials, for example. When we look at the decentralized model, we think about what would we need in order to do that? Well, we're going to need to know how to access other medical records. Okay, what is that role of the research nurse in that? Well, the research nurse is heavily engaged in adverse event reporting. They're going to need access to medical records. So what is that? How do we incorporate that into the decentralized model? How do we incorporate patient education? Are we going to be using more telemedicine, more telehealth? Okay, then what does the research nurse, the clinical trial nurse need in order to conduct patient education in a decentralized manner? And using the technology. So using telemedicine as an important avenue, but other tools like the e-pill diary or the e-drug accountability form. These are going to be important tools in that model. E-consenting, all of those things that the trial nurse is going to have to interface with in order to help the patient journey like they would if they were not in the decentralized manner. They will need to be able to incorporate using technology. The AI, I think it's incredibly important for us. We're already considering what would it mean to have AI help us with patient screening and matching trials. That is an evolving technology, which I think our clinical trial nurses are very heavily involved in finding patients for trials and determining eligibility, and being able to have AI tools to help integrate into that work is going to be leaps and bounds of support that will be able to improve our access, improve accruals, and be able to do that work faster and easier.
Thank you so much again for joining us today, RuthAnn.
Thank you for having me. I think this is an incredible opportunity. I'm very passionate about clinical trial nursing, and I am excited to see what happens for the future with us.
The advertising messages in this episode are paid for by Natera. Empower reflexes to RNA only when splicing impact is suspected, resolving variants to support clearer decisions without any extra tubes, additional steps, or additional cost. Choose pre-curated panels or create your own custom panel of up to 190 plus genes. When timing is critical, the breast stat panel delivers results within 5 to 7 days on clinically actionable genes to inform breast cancer surgical decisions. To learn more about Empower, including Natera's broad in-network coverage and personalized cost estimates through their price transparency program, visit natera.com/empower.
Oncology nurses are stepping into the pharmaceutical spotlight and reshaping it. Their role has expanded far beyond bedside care, and the pharmaceutical industry is increasingly recognizing their clinical expertise, patient advocacy, and leadership potential in the field of oncology. Bertie Fields has worked in the pharmaceutical industry as a nurse educator, medical science liaison, and in sales. She began her oncology nursing career before becoming a nursing student as a volunteer for Ohio Cancer Information Service. She began her career as a bedside nurse and later transitioned to a research nurse role before entering the pharmaceutical industry. She has volunteered for SWOG, NSABP, the National Cancer Policy Board, the American Cancer Society, the Leukemia and Lymphoma Society, and family support groups. She is an active ONS leader, having served on multiple boards and committees. Thanks for joining us today, Bertie.
Thank you, Diane.
Bertie, what inspired you to pursue a role in the pharmaceutical industry, and how has that role changed since you began?
Diane, I always said I really didn't select my jobs. They selected me. My goal was to be a clinical nurse specialist after I received my master's degree. But in the workplace I was in, there were not any opportunities for clinical nurse specialists. And I saw this job posting for a research nurse. And actually, they didn't even call them research nurses. They were called research associates, but they wanted a nurse. So I said, oh, well, I'd never even heard of such a thing. So I decided to apply. I received the opportunity to serve in the role. And I actually managed patients on clinical trials and also managed data coordinators who were collecting the data. I loved the job, thought this is where I'm going to be for my whole life. And then you know how that goes. An opportunity came where we had some changes in leadership. And I thought, well, I need to do something different. So I was recruited to another hospital and I managed their research program and their tumor registrars. And when someone from industry came to me and asked if I was interested, I'm like, oh, I don't know. And actually, I think I'd looked into it previously, but the territory was very large and I had a son who was young at home. But this time my life was in a different space. So I said, sure, take my resume, and I got the position. I would say what helped me get that position was that I had a very great working relationship with members of the pharmaceutical industry who were in sales. They called upon me. I facilitated their ability to meet with physicians and collaborate. I was well known to them, so I guess I was considered a partner with them. So they were more than happy to make me a more permanent partner. All of that happened because of also my role in my chapter. In my chapter, after you served your term as president, you became the vendor liaison. Well, I saw that the person behind me was a bone marrow transplant nurse who was coming up to be the president. Back then, bone marrow transplant units were like Fort Knox. A rep couldn't get in there if they tried. I couldn't get in there very easily. So I said, you know what? I'm going to make it easy on you. I know a lot of the people. I will do it. And back then, Diane, we were doing hard copy, like business cards and typing letters. It wasn't like now where everything is so virtual. You can find people easily. So I actually was in that role for 12 years, even after I got into the pharmaceutical industry. But having that role in my chapter helped me have exposure to industry. After my role as a nurse educator, I was a nurse educator in 2 different companies. And in the second company, we launched a new drug. And so my traveling was crazy. And then my son's like, my mom is never home. So another opportunity came up and I was for medical science liaison. And that was because of my role as a research nurse previously. So I took the position, loved the job, loved my manager, worked with a lot of nurses in that role, but also pharmacists and PharmDs. But the company itself was not exactly how I wanted it. And my company that I left, they knew I didn't really want to go, but I needed to do what was best for my family. So I hung in there with the MSL role. But then I actually was able to come back to the company I left in a sales position. I was happy as a clam to be back, and I was a boomerang, but they knew I didn't leave because I didn't like the company. So I came back in sales, which I loved because I actually had a smaller territory and I did a lot of the same things. I'm educating physicians, nurses, medical assistants, pharmacists about drugs, reporting any adverse reactions, all of those things, which I was doing as I actually was able to do on a more intimate level. I didn't have as big a territory, so I got to really know my customers. And the fact that I'm an oncology nurse, that gave me a lot of credibility as well, because I was giving drugs to patients in the past. And I have actually been in sales since 2007. And actually, I thought about going back to be an MSL or doing some other things. But because of so many other things that I do in my life, I think this is the best fit for me. I love that I see my nurse colleagues at the company I'm at now. So we have nurses who are managers of teams. Two of the managers are nurses. We have a manager who's head of training for MSLs. Most of our MSLs are, I would say, nurses, advanced practice nurses. We have nurses who are in global patient engagement, and I get to work with that person because it's her job to look at our patient consent forms and patient materials related to clinical trials. So I get to use my background in clinical trials to help look at, can patients really understand what we're asking them to sign up for? We have nurses who are patient advocates. And last ONS Congress, I met some nurses in industry who were called nurse navigators. And I know that you already interviewed a nurse navigator. Well, they have nurse navigators in industry, and they actually work both with the healthcare professionals and with patients. So I think that's one of the newer kind of exciting roles. We have nurses who are in marketing and nurses who are in the training departments. And all of our roles within our prior nursing experience and my roles with the Oncology Nursing Society have really helped to guide me to where I want to be with my career. I became active in ONS in 1988, and I have not left my activity in 88. I've served in a lot of different capacities, but I believe that has really helped me to secure positions within these companies because they see ONS on my resume and I get some elevation. Of course, I have to show the work that I've done for that, but I truly believe that ONS has helped me significantly secure positions that I have loved being in.
Thank you, Bertie. Can you please share with us how ONS resources have guided your practice?
The resources, I would say, actually so many. I am very active. Right now, we are planning our 40th anniversary for our chapter. So I know the people who are working in the biomarker testing or people who are very active in social media. So by being aware of who's involved in ONS and by virtue of the committees I've been on, I have very close links to bring their expertise to my chapter. Actually, today, I found out that one of the people I wanted to come speak can't do it for our 40th anniversary because her husband has to have some knee replacement surgery. Untimely. But I feel that I'm a very big resource to my chapter because of my involvement with the foundation, my involvement with ONCC and the board, so I can help continue to promote the resources that we have available to our chapters. And I'm really liking the new chapter guidelines that have been rolled out that will make our chapters even stronger. ONS has always provided the support that I feel has really helped me with my career in industry and my career with my chapter.
So as we look ahead to the next 50 years, how do we prepare the next generation of oncology nurses in the pharmaceutical industry for roles that may include decentralized cancer care models and the further integration of technology such as AI and clinical decision support tools?
AI, well, I have to try to make that my best friend, but industry is just figuring out the best way to use AI. But I think for nurses, many of my colleagues are going on to get masters in things other than nursing. They're getting masters in public health. They're getting masters in business. I have a colleague who's in IT. And so we should not limit ourselves. We should expand ourselves. And the more varied degrees that we have, we are more viable candidates for positions. I was never a clinical nurse specialist, even though that was my goal, but I have done above and beyond what I ever anticipated that I would do. And there are so many more new degrees for us to make us viable in this changing environment.
Thank you so much. The role of nurse practitioner was initially established to address the shortage in primary care. However, over the past few decades, nurse practitioners have stepped up to fill critical gaps in specialized areas such as oncology. Their evolving role is not just about clinical tasks. It's about reshaping the patient's experience of care with empathy, expertise, and innovation. Dr. Tamika Turner works as a local nurse practitioner for Weatherby Healthcare. She began her career as a bedside nurse 25 years ago and has worked in a variety of settings, including stem cell transplant, outpatient, and palliative care. She obtained her DNP in 2016 and has been active in Indiana Cancer Consortium, Cancer Support Community, Cancer Echo, and ONS. Thanks for joining us today, Tamika. So Tamika, what inspired you to pursue a role as a nurse practitioner, and how has that role changed since you began?
I became a nurse in 1997 to follow in my mother's footsteps. She continues to practice nursing today. My desire to help patients heal by providing them with focused clinical care and putting a smile on their face has kept me in nursing for the last 25 years. I love taking care of my patients with any medical issues, but oncology nursing became my passion. I did feel limited in fully expanding the care that I could provide to my patients in the nursing role, and that led me to pursue a degree as a family nurse practitioner in 2005. When I began as a nurse practitioner, the staff did not fully understand the scope of what nurse practitioners could or could not provide. That led to my being underutilized as a nurse practitioner in oncology and functioning in the nursing role to some extent. It took my educating the staff as to what care oncology nurse practitioners could provide that led to my being able to start functioning more as a provider in oncology. Over the last 25 years, I have seen the role of the nurse practitioner evolve from being limited in scope of practice by not being able to work at the top of our licensure to filling those critical gaps in healthcare. Nurse practitioners are now primary care providers in many health systems and rural areas where healthcare resources are scarce, as well as recognized by many insurance payers as primary care providers.
Tamika, can you share how ONS resources have guided your practice?
I have leaned on the guidance and expertise of the Oncology Nursing Society since becoming an oncology nurse. I continue to lean on their expertise as a nurse practitioner and utilize the many resources they have to offer. Some of these include evidence-based practice, research, clinical practice guidelines, and of course, their journals, the Oncology Nursing Forum and the Clinical Journal of Oncology Nursing. They also have many publications that I have utilized and clinical practice manuals for oncology nurse practitioners and the Advanced Oncology Certified Nurse Practitioner Review course.
So Tamika, as we look ahead to the next 50 years, how do we prepare the next generation of oncology nurse practitioners for roles that may include decentralized cancer care models and the further integration of technology such as AI and clinical decision support tools?
The Oncology Nursing Society will continue to be an invaluable resource to the next generation of oncology nurse practitioners. It is vital that the current generation of oncology nurse practitioners take the lead to mentor the next generation. The next generation needs to be educated regarding the importance of oncology nurse practitioners filling those critical gaps in healthcare by caring for patients in rural areas and those areas where healthcare resources are scarce. Technology should be utilized to bring oncology care, for example, office visits, imaging, and treatments, closer to those areas where patients live further away or have difficulty accessing transportation and healthcare. This will provide continuity of care. Artificial intelligence is being utilized in many facets of cancer care, for example, in radiation oncology and surgery, to help determine the appropriate treatment field and prevent injury to healthy organs and tissue. There are also clinical decision tools that are important as part of cancer care. The next generation of oncology nurse practitioners should be educated to look for those resources, including the National Comprehensive Cancer Network, which gives us guidelines on how to manage cancer from diagnosis to survivorship. Also, to prepare oncology nurse practitioners for future roles, we need to embed artificial intelligence and clinical decision models and training into core curricula and continuing education programs. We need to expand virtual care competencies through simulation and telehealth models, promote certification and continue education compliance aligned with Oncology Nursing Society and Commission on Cancer Standards. Again, support mentorship and leadership development. Encourage participation in innovation initiatives like genomic workflows and decentralized care pilots. The next generation should get involved with the Oncology Nurse Society and take advantage of the many resources as well as other educational forums to stay current and provide the best possible care to oncology patients and their families, as our goal is to provide holistic care for patients going through the cancer trajectory.
Thank you so much again for joining us, Tamika.
Thank you.
As ONS continues to look ahead, its commitment to shaping the future of oncology nursing remains unwavering. By engaging in forward-thinking initiatives, such as the 2019 collaboration with Bridgeable to envision cancer care 2029, ONS is proactively developing the tools, capabilities, and strategies needed to support oncology nurses in a rapidly evolving healthcare landscape. Just as has guided the advancement of nursing roles over the past 5 decades, ONS will continue to set the standard, ensuring that oncology nurses are equipped with clinical expertise, collaborative skills, technology proficiency, and mentorship support necessary to thrive. Thank you to our colleagues who've shared their insights with us today. Your voices affirm that although oncology care will continue to evolve, the values of adaptability, innovation, and lifelong learning will remain central to the future of oncology nursing.
The advertising messages in this episode are paid for by Natera. Through Natera's Hereditary Cancer Alert Program, Signatera patients who qualify for Empower germline testing are proactively identified. And through their family testing program, where the same size panel is offered at no cost to any blood relative for up to 180 days, Natera is working to close the hereditary testing gap for patients and their families. Get started at natera.com/empower. Thank you for listening to the ONS podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.